this lecture is going to be Introduction to Web Design. So we're going to finish off some of the other industry categories that we talked about. Where we already did patients and providers. Now we're going to talk about payers and producers. And then after that, we're going to talk about some of the basics of web design and get you all started on what's going to end up being your midterm project, which is creating a MVP mockup. Okay, so let's start with lean startup. So first question, and I'll put this out to you all. I think you're all muted right now, so make sure to unmute before you speak up. But does anyone know what an MVP is, or do they want to venture to talk about what they think the definition of an MVP is?
So from what I understood from it, wasn't it?
Ooh, hold on, my audio is not working.
You're good.
Okay, I can hear now. Perfect.
Okay, isn't it a minimal viable product or minimally viable product? So it's basically kind of like a starting point for a creator, like a startup company to use to see, you know, like when they send it to a user or a small group of users, what they can do to improve it and like make it into a bigger company or product or whatever.
Yeah, absolutely. I think that's a great starting definition. So let's dive into that a little bit. So when we talk about minimal, and this goes out to the whole class, why the word minimal? Well, what's the point? Why do we want to say that we want that minimal viable product?
It gives you the most information with the least amount of work.
Yeah, exactly. And then why do we want, so what are we really doing to get this information? And what does that have to do with the MVP?
You're giving it out to users and your possible market. That way they can critique it and find out if what you're doing is actually viable, it's what they want, versus you kind of going off on your own idea, believing that it's something that people want when in reality it's not.
Exactly. So you're putting it out to your customers, right? So your customers in a lot of ways are your bosses in this case. So you want to get their feedback as quickly as possible. And then finally, the viable product part. So let's talk about that a little bit. What does that mean?
Maybe something that you could actually tangibly give out to someone, that way they can get the idea across.
Yeah, so tangibly give out, but what might be that minimal part of what makes something viable?
It has to do the minimum function of what it's supposed to do.
Exactly. So it's got to do something, right? And we'll talk about that a little bit later. But it can't be sort of a nice looking incomplete product. It's got to be something that actually performs a function that you believe is going to be valuable to that customer. So next question is, what types, and remember this from the reading, there are a couple different types of MVPs. Anyone want to talk about what those types are and potentially an example?
So in the article, they talk about the video MVP, and like from what I understood from it was like the example that they gave was Dropbox, and like what they did was they showed a video to like the community of the tech community and like tried to get them like interested in it and gave like a very like small narrative just showing like what the product was and like what it entailed, and just by doing that they were able to draw on like many people who are interested in it.
Yeah,
and
absolutely.
The other one was the concierge MVP, and this was basically like the example that they gave was like the Austin-based company where it was you identify like the grocery store and like you kind of checked off what you wanted in food, and then they like got back to you. And I think this was the one where they only had like one person interested and signed up, and then like it was just very much tailored to them.
Yeah, exactly. And there's a lot of companies that, even beyond what they talked about in this book, that are huge billion-dollar companies right now that just started off as a video, right? And with Dropbox, because, that founder really knew his community that was going to be the early adopters for that, he was able to post it on a message board that is very well used by that community. And so that video actually went viral, and that helped him get funding without even having a product. And then the same goes, like you said, with the Fresh to Table, where sometimes it's not easy to build all the algorithms and all that might be able to make something happen, like say a Blue Apron. And so you just have to have people get out there on the ground and do it themselves. Airbnb started that way too. I think for a longest time, they only had a handful of people in New York, and they actually lived in San Francisco. All their customers were in New York. They had to move out to New York because that's where their customers were, just so that they could sort of have that hands-on experience. Okay, and then what's the point? And we touched upon this a little bit, but I'd like to really drill into this because it is so important. And this is one of those things that even if you know the right principles, a lot of people just don't end up following it in practice. Why release an imperfect product? Isn't that kind of scary? You want to put a product that doesn't work the way that you want to out there to the broader world.
Is it to get consumer and customer feedback to better your product, to see if their needs are met with the product that you're creating?
Exactly, because, and just to dive into that a little bit more, I think, especially in academia, right, we try to figure out the perfect solution on our own or through our studies or our research. And really, there's no better research than getting something out there and seeing how it works in real life. It's like, that's the reason why we do fire drills. And, with this coronavirus, this experience of going through this is going to be better preparation for the next pandemic than any amount of research or studies would end up being, because you just kind of have to get it out there and see how it interacts with customers in the real world. So that's really why we want to release an imperfect product. And like I said, a lot of people in real life, they can't quite grasp it. Even if they can grasp it intellectually, in their heart, they don't want to release something that's imperfect. And so that tends to lead, even in established companies, to a lot of delay in releasing certain iterations of a product, because everyone wants to get it perfect when what they really need to do is just get it out there so that they can get the right feedback. Any questions about that?
Is there also kind of like going off of what you guys just said, in a financial aspect to it? Like you are kind of also saving costs by not investing as much time, effort, and money into putting this whole idea together, and you kind of just like put out an imperfect product so you can kind of like test the waters to see if it would actually work?
Yeah, what do you think? What do you think the financial implications would be of that?
As in, like, if you're like, instead of putting like a full like all this time and effort onto what your idea actually was, and it end up not working, you kind of end up saving money in that, like, you're putting in an imperfect product, but you're also saving time and money because you get to like get this feedback.
Yeah.
To see if it doesn't work out, then like you're saving money, rather than like putting a product out there like all this time and it just kind of doesn't work out, I guess.
Absolutely. I mean, that is 100% a big component of why we do MVPs. It's because we don't want to invest a lot of money into something that customers don't like or don't want, right? So getting it out there at that early stage where we haven't invested a lot of money can really be of value. Can anyone think of an example in healthcare where this is really an important principle of getting something out there early or figuring out whether it works early?
Is it preclinical testing?
Yeah, absolutely. Expand on that a little bit more, though.
Well, when you're testing out something, I guess you're trying to see if it works in animals first before you give it to the human population. So you want to see if it's safe, if it's efficacious, and if it's, if it does the job.
exactly. And it's even goes beyond preclinical. So preclinical is a great answer, but that's really just the start, right? Because it's also phase one. We want to kill a program that's not going to work in phase one as opposed to phase three, or if not phase one, in phase two as opposed to phase three. It's that we have these gates in place because we want to make sure that before we make the big investment in a clinical trial of that big phase three, that we've really made sure, yes, we do think that this has a good chance of working. So, clinical trials work a lot of the ways similar to what we're talking about with MVPs, where you're trying to figure out whether something's going to work as early as possible before spending as much money as possible, so that we can really get a better understanding of what's going on, what are the dynamics of the market, what are the dynamics in the case of a drug of, how it works within the body. So they're very similar, right? There's only so much you can do in theory and in planning. You just got to get it out there into the real world and see how it works. Okay. So I want to talk a little bit about your ideas because I thought there were some really good ones. I'll call on a few people, but first I want to hear, are there any volunteers of anyone who wants to talk about your idea? Or not your idea, but the example of an MVP.
I don't know if you can hear me, but my idea was like Amazon, if I was the CEO. I talked about like how they have the reviews at the bottom for the consumer to see like how the provider is like giving away the products as well as like if it's good or not, and then those reviews can be used to improve upon how they deliver their product as well. And they talked about how they compare prices of like that same product and like the stars and the ratings of it.
Yeah, absolutely. I think that's a good example. And I think, there's actually, I think Alvin, you also picked Amazon as well.
Yeah,
what are your thoughts on that? Because I feel like your answers were pretty similar, which I liked.
Mine was basically just kind of like Amazon's idea in the beginning was just simply like delivering any products to your doorstep rather than having to go to buy it. And I think that was their incentive. And then I kind of expanded on like after they realized that that was kind of like a good thing, like they kind of expanded on adding other features such as like Amazon Prime, to where it's like if you have the Amazon Prime, like you don't have to wait like 6 to 8 business days, like you get it within like 1 or 2 days. That's kind of what I talked about.
Yeah, great. And then I think, Samantha, were you the one who was talking about, I think it was having a few relationships with sellers, like gathering all the sellers and finding the cheapest product?
Yeah.
Talk about that a little bit, because I thought that was interesting.
On some products, like it'll be like, okay, use, buy new and stuff like that. So then sometimes at the bottom or lower on the screen, it'll like compare the items across and be like price, provider, stars, ratings, and yeah, I don't know what else like or remember what they put down, but
Yeah.
they did.
And I think one interesting concept there is, especially at the early stage, you don't need to do a lot of this yourself. You can just be sort of an information provider of figuring out who's already selling something and just putting all of that information into one place. That can be a big service to customers, regardless of what you yourself are doing, right? Regardless of whether you have these big warehouses that Amazon now has or this big delivery infrastructure. So I think that's good, right? It's like focus on what really provides value to customers before you have to put all these huge capital outlays to build these, distribution centers and all of that. Okay, anyone else? I think one that I found interesting was Natalie. Do you want to talk about yours?
So I did about Walgreens. So we know that Walgreens it specializes like in health and wellness products and filling prescriptions. So I made a like a app from scratch. Like I just made it up, and it was called Wellness Plus. So we know Walgreens already has an app but this one just focuses on like more on the prescription aspect. So I so it's called Wellness Plus, and then so once you download it, the app will go ahead and ask the patient like the preference language, because usually automatically apps like go straight to English, but some patients they don't speak English, they speak Spanish or French or any other type of language, so they will ask that, and then from there, what else did I write? I'm thinking. Oh, it will monitor how like the patient is doing with their current prescription, in order to provide like that quality care. And like say they're not feeling well, then they can go ahead and tell that representative like through the app to go ahead and call the doctor that's like on the patient file when they go ahead and fill everything up in the app, and then to go ahead like and make that appointment. So that's how I went about it to do the MVP.
Great, yeah. And I think the reason why I wanted to call that out, the thing that I found most interesting was the language part, about how you talked about they can specify which language they would like to speak with the representative in, because that's something that really is a barrier to healthcare for a lot of people, right? You walk into a Walgreens, which is a typical Western, wellness store. You don't expect that they might be able to speak with you in Spanish or Korean or whatever your language is if English is not your first language. And so having something like that, and you can go concierge style to just have sort of a couple translators working with you. You don't have to have built out this huge infrastructure, product infrastructure. All you have to do is provide that very simple task for these patients to help keep them more sticky with Walgreens, because there might be a temptation for them to not want to go with Walgreens because they'd rather go somewhere where they feel like there's more likelihood that they'll have someone speaking to them in their own language. So I think that's a good example where, you can just have sort of the person behind the curtain, right, that's making it work while you build up eventually, hopefully, capabilities to do like automatic translations, things like that. Another one that I wanted to call out was, Zaid. Do you want to talk about yours?
Yeah, definitely.
Zaid, is your screen working?
I'm actually trying to get that working right now. Let me try a few things. Okay, there we go. Can you see it now? Okay, perfect. So yeah, one of the apps that I've actually been using myself for a little while is Headspace. So it's kind of straightforward. It's just guided meditations essentially for whether you need to go to sleep or just chill out for a little while, that kind of thing. So the one thing that I thought about is if you were to strip that down a little bit, kind of make it into an MVP, it would really just start out as really someone who's just on the other end of, say, something like we're doing right now, say a Zoom session or Skype or something like that, doing essentially the same thing, guiding you through a meditation and that kind of thing. I'm not sure if that essentially qualifies, but it was...
Well, the reason I called that out is because that's almost exactly what actually happened with Headspace. So I think it's a good example where you can see how someone just doing something like an online class can really turn into this app that works for a lot of people. Whereas they started doing these live sessions, they didn't end up needing that for the long haul. And now it's something that's a lot more optimized. But if they tried to go about building that app the way that it looks now, they probably would have failed because they wouldn't have been able to provide the right customer service. They wouldn't have known which features were the most essential ones yet. So that's another example where you're really going concierge rather than trying to optimize everything from the start. And that's what they did. And here they are.
Okay, interesting.
Cool. Anyone else? All right.
If
Oh, go ahead.
Yeah, sorry. So I did mine on Airbnb.
Mhm.
I've noticed everyone else is a lot more drilled down. Mine's a little bit more on the surface, but so pretty much strip it down to just having the homeowner or the landlord being able to list their home on the site, set up the payment method, and just go from there. So the idea is to pretty much see what are the resistance or the barriers of why like a landlord wouldn't rent in a short term to a tenant. It's pretty much some ideas would come out like background checks, maybe a more streamlined service type thing.
Yeah, absolutely. I think that's a really good example too, where you can look at what the founders did. And I'd encourage you to do that. The main founder's name, I think, is David Gebbia. And if you just Google him, that he does a lot of podcast interviews with people where he talks about their process going from that MVP to where it is now, and how they really try to figure out, okay, well, what is the dream platform for a customer? And then how do you work backwards from that, what he calls a 10-star experience, to, well, how can we at least get to a 4-star experience? What are like the core components that the customers really need? So I think that was a great example as well. Okay.
I have a question.
Yes.
How do you like determine, like, so if you're going to release an imperfect product, how do you determine, like, you obviously don't want to start and everyone be like, this is awful, and then not give it a second chance type of thing. So how do you like draw that line?
Yeah, it's a good question. I'm intrigued by the way that you asked that. Can you think of any examples in real life where that happened, where someone maybe released a product that wasn't ready yet and it hurt their brand more than it helped?
I'm trying to think. I know like there's apps I've heard of where people have been like, do you use this? And they're like, oh no, I used to, but I didn't like blah, blah, blah. And people will be like, oh, well, they do this now. And I can't think of anything specific, but it's not, I mean, I'm sure you've heard it too. I guess with like workout apps, maybe I've heard it. I don't know what else.
I can think of 2 examples off the top of my head. One is Apple Maps. I don't know if you'll remember that. So Apple rolls out this Maps app to compete with Google Maps, and some people ended up driving into these weird alleys, and it just sort of misdirected people, and it really hurt their brand. And I mean, I have an iPhone, and they still try to push Apple Maps on me, and I just can't do it. I refuse because I had enough bad experiences early on. Another example right now, are you all using certain video sharing apps that are not named Zoom and having maybe not so great experiences? So I know that I've had that experience. I had a few friends, I think it was called House Party, trying to use that, and it just didn't work. And it is something that, you know, everyone really wanted to work, because with Zoom, it's harder to play games with each other, but it lagged. And so I think in times like this, you had a lot of startups. It was their time to shine, you know, to see, okay, well, what can you do with video sharing? And
Like
Zoom,
a party app.
yeah,
Like for half of the population.
exactly. And Zoom is really shining, but there's a few others that like this could have been their make or break moment, and unfortunately they broke. So there is risk to releasing something too early. And to be honest, what I would say is if you're a startup, that risk is minimal. If you're someone like Apple, I think there is high risk because you have a brand to protect. But if you're a startup, and especially if you're at MVP stage, the idea is you don't really have a brand to protect. So the downside is minimal. If you disappoint 100 customers, well, there's another 200 million out there for you. So I think the risk is just a lot lower. Now, there is a little bit of risk in healthcare, right? You don't want to provide a broken product that could end up releasing someone's confidential health data into the public, or might lead them to make healthcare decisions that might end up in adverse reactions or you know, even fatalities. So there's an element in healthcare where you have to make sure that you do no harm. But as long as you're not there, I think the risk to a startup of brand credibility is extremely low, because you're almost certainly, when you roll out the MVP, not going to be in a scenario where it immediately goes viral and pisses off the whole country. So I would say that as a startup, that's something not to worry about quite as much. But we've certainly seen examples where it has hurt companies. Okay, so moving forward. We'll go back. Well, actually, before we start with this, any other questions about lean startup? Really, the only thing I wanted you to gain from that is what is an MVP and why is it so important to roll a minimum viable product out to customers early on in the process. Any other questions on that? I would highly recommend the book otherwise, especially if you feel entrepreneurial and you want to understand how best to go about starting a company. But for the purpose of this class, really just that chapter. All right, so on to producers. Who are producers? I'll actually ask you that. Who are producers?
They're the pharmaceutical companies. People, pretty much anyone who makes the drugs or devices.
Exactly. So drug and device makers. So they're the ones who are making this stuff. Operations is incredibly important to these companies. And within operations, we have clinical trials, which are how do we logistically get the patients enrolled into these trials that are designed to test the safety and efficacy of the products that they hope to roll out once they get FDA approval. Manufacturing. So once they're there, they have to manufacture at scale. This was actually when I worked at Baxter Healthcare, I was in manufacturing, and there were a lot of IT type of products that we were implementing to either help schedule batches, to help us meet demand in a more efficient manner, or just basic management techniques. So how do we manage our different shifts or our different product lines to make sure that they're operating in concert in a way that can optimize our supply chain. Real world evidence, I think, is a growing area within operations. So when I say real world evidence, does anyone know what that means, real world evidence, in the context of healthcare? And why digital health is important for that?
One example I can think of is post-market surveillance. Like after you launch your product, that's where you get your real world evidence.
Exactly. So when we do a clinical trial, we are doing that clinical trial in a very defined, unrealistic population. So there's a whole list of eligibility criteria. Usually if you're doing a non-cancer medication, you can't have had any previous cancer, things like that just aren't realistic in a real world setting. So when we talk about real world evidence, it's once that drug is out there, how can we better understand how it's working within the much messier populations that it's actually being used to treat in compared with clinical trials. And that's traditionally been very difficult to do. But with certain monitoring apps that patients can use, we've gotten a better handle of how we can measure real world evidence. That will also, by the way, become a lot more important when we start talking about things like paying based on outcomes, right? So remember last lecture, we talked about paying per procedure versus paying for the outcomes. The reason why we don't pay for outcomes is because it's incredibly difficult to monitor. However, we've gotten so much more advanced in our technologies that are able to monitor our healthcare on a continuous basis that suddenly monitoring real world evidence to try to determine how much is a drug really worth, right? And should we just pay for this when it, say, works for a given patient? That's suddenly become more realistic. And so that's a really promising area where real world evidence can both increase our overall healthcare outcomes as well as decrease the cost that it takes to get there. And then finally, there's digital health apps, right? And this is sort of where I'm talking about how can apps be used internally within a company to help them function, right? And there's not really a lot of difference between these apps internally within a health company versus the apps that you might use in any manufacturing company. Okay, so I want to talk as a storyboard example about metadata. So the problem that metadata is looking to solve is that clinical trial coordination is poor. So oftentimes you have a lot of different stakeholders within a company that are running the clinical trial, from the physicians that are administering it themselves to the epidemiologists that really want to figure out where are adverse events coming from, to the developers, the R&D that are trying to make sure that they're advancing the product through the pipeline at a good pace. The coordination there is bad, right? And this might sound a bit like an echo of what we talked about with physicians, right? When we talk about, for instance, cancer care teams, remember we talked about that. They don't talk to each other as well either. This is a problem throughout the life sciences industry. And the manufacturing companies are not spared of this problem. So the inputs are, what are the different clinical trial sites? So that's another thing about clinical trials, is that it's typically run through multiple sites, right? They might be working with UCLA, Stanford, University of Texas, and Georgetown. And those sites don't care who each other are. They don't coordinate. They don't talk. Why would they? Well, something like metadata can help them coordinate. So you input that data of who those sites are, what the data is coming in on the clinical trials, and then the patient data. And then the outputs are more enrolled patients, right? Because the sites are often responsible for recruiting, but they don't know what their goals are relative to other sites. So this can help them achieve those goals, as well as performance analysis. So here you can have whoever's in charge of the clinical trial sit on top of this app and look which sites are performing the best, and how can we use that information to optimize our clinical trials and maybe provide a little nudges to the ones that aren't performing, or dump more money onto the ones that are, so that they can do even more work. So storyboard, the scene is that a biopharma company starts a clinical trial. The platform then analyzes the data that's coming in on that clinical trial and then recommends paths forward. Decision amount around protocol amendments. So these are things that are very expensive, right? Sometimes we might figure out, okay, well, we added as an ineligibility criteria that the patients cannot have, for instance, cancer, right, for this diabetes trial. Well, it turns out that as we're trying to recruit, a lot of patients are dropping out because they have a history of cancer. Well, if we see that, we then want to make an amendment to that, and that's really expensive. So we want to make sure that we only do that when it's absolutely necessary for forwarding the trial. And this app makes recommendations based on the real data that's coming in. And then the desired outcome is a more successful and quicker clinical trial completion. Any questions about that? So it's basically a coordination app that helps all the different stakeholders of a clinical trial talk to each other, see the same data, so that they can make the right decisions at the right time. All right, next is Beyond the Pill. So this is one of the more, I would say, active areas on the producer side. And I believe, Mohammed, you asked last week about what is the most promising area from a pharmaceutical marketing standpoint that if you were to build an app, they'd be interested. And I'd say that's this Beyond the Pill stuff. So with here, we're talking about either digital therapies themselves. Remember last week, we talked about a diabetes app that helped diabetes patients manage their therapies, and it was actually FDA approved based on its ability to improve outcomes. I think there was also something with addiction along those lines. Now, those are obviously very interesting to pharmaceutical companies because they can use that to supplement what they're already doing in a disease area. Patient engagement is also huge, right? If you've got a drug, particularly a chronic drug that tends to be very sticky, you develop a relationship with that patient. And I see this with many companies. You know, if they're working with, say, diabetes patients, they're at all of the diabetes conferences. They're trying to form relationships with these patients because it becomes a part of that patient's life. And they want to make sure that that part of their life is not just a burden, but is made as easy as possible, as smooth as it can be, and that there's really a relationship established with that patient. So there are engagement apps that are being built that enable the company to talk to these patients and get feedback from them and improve their general communication from company to patient. There's also education. So here it's similar to patient engagement, but it's just more on the information side. So there's a lot of drugs out there that are becoming a little bit more complex, right? It used to be that all drugs were pills. Now there's self-injections, things like that. These are difficult to use. I don't know if anyone's ever had to inject a grandparent or anything like that and had to go through that process with the pens, but they're not easy to use. And when you're talking about injecting an older person, a family member, it can be very intimidating because you certainly don't want to screw up. So there's informative apps out there now that help guide you as the administrator of the app, you know, or of the drug, whether it's to yourself or a family member, through that process so that it can be made more straightforward. There's also drug adherence. So these might be in the pill themselves, right? So how do we know when a pill's been ingested so that we can monitor, is it being taken? And if not, does a physician need to reach out to the patient? It could just be a reminder type of thing, right? If it's a daily pill, that's easier to remember, but I'm sure, you know, anyone who's taken a daily pill has forgotten, you know, every once in a while, and having those reminders can help. If it's a weekly or a monthly or something like that, it's even more complex because how do you remember what is that day of the week that you need to take the drug? So there are apps being built to help patients do this. Okay, so here I want to talk about ForCare, and this is an app that's basically made by Novartis, so it's made in-house, and it's dealing with the difficulty of managing a chronic illness. So the producers are the ones who actually make it. It's for their benefit, but I would also circle patients here because the patients are also benefiting and using this app. So the data inputs are the patient's info, their prescription info, and then their health data as they move forward. The outputs are notifications to that patient, as well as information about the disease and health resources for that patient. And of course, this is sort of under the umbrella of Novartis, so it's within areas that Novartis works within, right? So you might imagine with Novartis, they're really big into cancer. So this might be provided for all of the patients who are on their cancer drugs. So Storyboard is a patient with a chronic disease begins their treatment regimen. After that, they enter their prescription and also the info on whoever their doctor is. And then ForCare will provide them with alerts and their guidance through the treatment regimen that they're going into. So it might be able to also warn them about certain side effects or certain things that they need to make sure that they take care of as they're taking the medication, right? Maybe they shouldn't be, you know, drinking alcohol or something like that. Or they need to wait for a couple hours to take the pill on an empty stomach, something like that. They help with that. And then the desired outcome is that patients are more adherent to the drug, which is a huge concern among these producers as well as the doctors, and they're less confused during their treatment journey. So by providing this app as a guidance, we're able to better prepare the patient to have a successful outcome at the end. And I feel, and this is just a hunch, but I feel like apps like this are going to become a lot more valued by companies as payment models start to shift to paying for outcome. Because all of a sudden it's not just, okay, well, we get the prescription and then we can forget about it. Now they really do need to make sure they have a vested interest to ensure that patients are adhering to the medication and doing everything that they need to do properly to ensure optimal outcome. And then of course, for the companies, optimal revenue. So I think that's another benefit where once we start moving towards paying for outcomes, which will be enabled by digital health technology, we can really improve our healthcare system. Any questions on that? Okay, next, diagnostics. So, you know, we're not just talking about drugs, but also diagnostics. And with diagnostics, I think they're starting to see a real revolution due to digital health. There's more behavioral apps out there than there ever were. I mean, there were probably none out there 5 years ago, but now you've got entire companies that are based off of these behavioral apps that help manage a patient's behavior from a healthcare perspective to help improve what's going on with their health outcomes. There's also mobile devices being used. I don't know if you've ever heard the stories of physicians using iPhone stethoscopes, but that's a thing. There's a lot of different add-ons that if you're a physician, you can get to your smartphone that could enable you to do a full primary care workup using your phone. And so there's a lot of intriguing technology or intriguing potential there from use of this technology. We're not quite there yet, but they exist. And I think there's a lot of potential with what we can do with them. So I'd also just call out there, if for your prototype project, you want to do something based on these sort of add-ons, I'm okay with you pretending that you've already developed like a stethoscope, a smartphone add-on, and then you're just using fake data from that for the app. I think that is perfectly legitimate, because for this, we're really working on, okay, well, what would that user experience look like? Passive listening, this is sort of when you hear, Apple, I think, is an example where they started getting into health, and they're starting to talk about how they can monitor all these things from your iPhone. And in fact, I think they claim that they've even helped people out while they're having a heart attack because their iPhone senses it. So there's a lot of passive listening technology going on. Of course, this also applies to things like Fitbits, and building applications on top of that to see, okay, well, now that we're listening to your heart rate at all times, or now that we're able to track your sleeping, what can we do with this information that can be beneficial to you as a patient? And then, of course, that ties into a little bit of IoT. So either software on top of existing diagnostics or software on top of sort of your more traditional doctor's tools that can help you do a better job. An example here that I've heard talk about is with diabetes, foot lesions are a thing. So I don't know if you've ever heard of the fact that people with diabetes can lose their foot. I think that's a common thing. The reason they do that is because they end up with these lesions on their foot that they don't notice. And then eventually they start to get gangrene, things like that. And there are now scales that are being developed that can sense those lesions and then be sent directly to their primary diabetes care physician for further analysis. So that's a cool example where if those were being used by all diabetes patients, which is a big stretch, but if it were, then it could really prevent one of the biggest problems among late-stage diabetes patients, which are these lesions that sometimes lead to amputation. Okay, so I want to talk about ResApp. So this is for respiratory diagnosis. And the problem is that it's very difficult to do respiratory diagnosis at home. By the way, this is very relevant right now because respiratory diagnosis, one of the biggest differentiators of whether or not you have COVID-19, right? So there are a lot of people who might have a fever, chills, all the hallmarkers that they might have it, but if their respiratory signs are okay, they probably don't want to, in fact, the last place they probably want to go is the ER, right? You really want to go to the ER only if you've actually got COVID-19 right now, or obviously if you have another emergency. But if it's just a regular run-of-the-mill fever, you probably just want to stay at home. So this ResApp, it takes patient information and their breathing into a microphone. And then their outputs are an actual respiratory diagnosis, as well as an immediate connection to a physician. So here, if a patient thinks that they may have a respiratory issue, they download the app, and then they enter the information in, just breathe into the microphone, and then it makes a diagnosis, and then it communicates that to a physician. So the outcome is a more efficient way to make a respiratory diagnosis. I think right now, what people are saying with regard to COVID-19 is try to hold your breath for 10 seconds. And if you can do it, then that's a good sign that you don't have it, or at least that it's not to the point where you need to go to the ER. This, I guess, is just a more sophisticated way to do that. And they can tell just based on your breathing patterns whether or not something might be wrong. So, this is very early stage, but you could imagine maybe if it were more mature, this could really be something that could be adopted nationwide to prevent, I guess, false positives of people thinking they have coronavirus or thinking they have COVID-19 and then going to the emergency room and filling up what's already, at capacity in certain cities. Any questions about that? So again, another good example where I don't really care when you're building your prototype if you've actually figured out a way to monitor the breathing, but just think outside of the box of, okay, well, if I could, how would I turn that into an app? And then that would be acceptable. And then you just have to kind of work backwards and figure, okay, well, how am I actually going to do that? Okay, drug discovery. So here is where, if I'm completely honest, there's a ton of hype and not a lot of real accomplishment, but there's still a lot of promise. And with hype like this, down the road, we end up seeing a lot of results. It just, I think, takes longer than people might want you to think. So here we talk about in silico research. So this is using things like machine learning and complex models to figure out what drug targets might work in the human body without ever actually having to use them in humans. So remember, we talk about wanting to basically nix programs before they cost a lot of money, right? And that's where we talk about preclinical research, or in silico could be another version of that, where if we have a model of what a human body looks like, then we can say, put the drug into that computerized human body and figure out whether it's going to work or not. Again, we're not there yet. We don't really understand the human body. The people who understand the human body most, I think, are the people who probably would tell you that they understand it the least, because it's one of those, the more you know, the more you realize you don't know type of things. But there's a lot of promise and a lot of funding that's going into companies that are trying to develop, how could we actually do preclinical research on the computer? R&D cloud. So that's another thing where, we talk about in healthcare, there's a lot of silos, right? And there's research silos are very common, where people who are doing research in neuroscience aren't talking to people who are doing research in, say, heart disease, or people who are doing research in neuroscience in one company aren't talking to those in another company, or one university aren't talking to those in another university. So that's a big thing. And there's apps that are starting to be developed to help them talk to each other to improve research. AI. So again, that's another thing where, because the human body is so complex, and because we're starting to understand a lot more about the human body to the point where it's almost becoming too much information, right? We can now analyze the genome, the proteome, the microbiome, the RNA-ome. There's all these things we can analyze, and it's just too much for anyone to understand. So there might be something that we could dump into an AI and have that AI tell us, oh, you know what, we saw this association between what's in your gut biome and your likelihood to recover from a heart attack. And so that might be something that we can build a treatment for. So that's starting to be used a lot more. Again, it's still early, the returns aren't yet being seen, but there's a lot of promise there. And then bioinformatics. So this is kind of along the same levels, is as we develop more and more data, either about the human body or about populations, large populations of people, how can we make sense of it, right? And how can we communicate it across different networks, across different industries even, to build solutions that can actually improve health outcomes? So here I want to talk about Schrödinger, which is one of the probably the more advanced machine learning platforms out there in healthcare. So the problem that they're solving is that drug discovery is siloed and inefficient. And the inputs are, for a given clinical program, what is that drug target? And then what are the desired characteristics that you would like to see of a therapeutic that hits that drug target? The outputs are potential lead compounds, as well as property prediction about those compounds. So this is kind of a, I guess, a parallel to a high throughput screener, right? Anyone know what a high throughput screen assay is? So that's sort of where you know that you want to go after a certain target. Let's say with Alzheimer's, you want to go after these amyloid plaques that you see with a lot of Alzheimer's patients. You do a high throughput screen where you basically run thousands, even hundreds of thousands of compounds against that target, and then figure out whether there's any sort of activity and what kind of activity that is. Now, with Schrodinger, they do a lot of that on the computer to help produce what potential promising drugs might look like. So the storyboard, that a company wants to develop a next generation drug. The company then inputs the target mechanism and then the desired properties of the drug that they want to develop. The platform then returns a list of the top potential compounds based on how it thinks they're going to interact with the target. And then the outcome is more efficient, thorough lead optimization and less time. So here you can just kind of see the type of data that it spits out. So in this graph, the kind of the circular or the pentagonal one, it's got all the different properties that that company wants to look for and how well each drug candidate does on those different properties. And then there's all kinds of other information that it spits out that's like beautiful to the eyes of an R&D scientist, but maybe less so to anyone else. So that concludes producers. I think that just kind of gives an overview of the different areas in which producers are using digital health. Now I want you all to go back onto that form that you used in previous, last week's lecture. Let me see if I can copy it. And then come up with something that you see. Who wants to share what they put down?
I can do mine.
Okay, great.
So I found a company, it's called Systems Oncology.
Oops.
And what they're doing is they're using AI to like better understand the data sets that they get from like cancer and stuff. So they're breaking down like the vulnerabilities in the cancer within the AI, and then also like their current treatments that they think that will work. And the AI kind of puts them together and like gives them a probability on the likelihood of that treatment working. And so that they only have to put in their like money and effort into expanding on the ones that are the most promising.
Very cool. Yeah, so this is sort of, it sounds like another using AI to figure out how can we minimize costs during the drug development stage so that we can just focus on those that are most promising.
Yeah.
Really cool. Anyone else?
The one that I found is called, I lost it. Okay, here we go. So one that I found is called Gauss Surgical. And basically what they're tackling is not so much cost per se, but something that's more OR related. So they're basically using AI to quantify blood loss in real time during surgical procedures. And all it is it's just an app that you can download on either an iPad or an iPhone. And what they do is they take the sponges or the towels as they're used in real time, and then they photograph them, and apparently it uses pixel measurements to just quantify in real time how much blood loss is occurring essentially.
Very cool. Yeah, so this is kind of something that you really wouldn't have thought of just kind of off the top of your head. It sounds so basic as, you know, how much is a piece of gauze, you know, saturated with blood, but, you know, how useful that can be. And so this is another example where I think, especially if you're a physician, you know that something like this is a huge problem. But typically, if you are a physician, you have no idea how to build an app like this. So it just kind of becomes one of those, oh, well, someone should do this type of ideas. If you have those basic skills, it really empowers you to be able to develop that app on your own, because I'm sure this app isn't really all that complex. But you know, if you are in that OR and you're having these problems, you know what the need is. Whereas someone who might be great at making apps has no idea, because they spend a grand total of 0 time in the OR and they don't know that this is even an issue. Okay, anyone else? Monica, you had a good one. Do you want to talk about yours?
Sure, but I don't know if I picked the wrong one, but basically it's an app. And like now that I'm thinking about it, it's kind of more targeted for like patients than producers. But basically it's an app that, you know, people would go on there and basically if they're struggling with mental health in any way, they describe what they're feeling, what some issues are, you know, what thoughts that they're having. And they kind of, like the app will provide them with sources, like different tasks they can do to try to get rid of those negative feelings, or to, you know, provide them a space where they can securely journal, you know, the stuff that they're struggling with. So it's kind of using what therapists would use, like cognitive behavioral therapy, to help the patients.
Yeah, and I think you're right. It is kind of patient focused. However, I think it would fit within the where the producers want to increase their engagement with patients by using something like a digital app, because I think it was very similar to what a lot of companies are using, right? It's sort of how do you help them manage that behavioral component while also potentially taking some of the drugs that you have offered to make sure that the benefit from those drugs is as maximal as it can be. So that's why I wanted to call that one out.
Mm-hmm.
Okay.
I assume that like it's meant that therapists would recommend the app, so that when they meet with their patients, they can kind of see like, okay, like how's the app working for you? What's the journal doing? All that stuff.
Yeah, exactly. And I think it just overall sort of enhances the relationship between the therapist and the patient, as well as potentially the producer if they're making a drug in that area. Okay, anyone else? All right. Oops. So back to the presentation and our final section, which is payers. So payers are our health insurance companies. One area in which they really do need a lot of help is in operations. So here we're talking about their management with their different clients, whether those clients be the patients themselves or the big networks that they have contracts with. Within that is also provider management, right? So here's the networks that I'm talking about. You have either whether it's a private practice, how do they work with them to help them make the best decisions from a cost perspective, as well as hospital networks, and even sometimes employers. There's also claims. So claims, obviously, if you're an insurance priority or provider, is really how your business runs. And so having the most efficient claims system, I think, can really help them focus on providing the right type of care, as opposed to just kind of getting buried under a mountain of claims. And then data privacy is becoming a bigger issue. You know, as hackers are realizing that there's a lot of data within these healthcare insurance providers, they're starting to attack them. So there's a lot of security apps that are starting to be built to help them fight against that. I want to talk about Sidecar Health. So Sidecar Health, basically they're trying to tackle the fact that we as patients often have no idea whatsoever how much a treatment that we're getting is going to cost. And in fact, those patients who are more discerning and are actually asking questions at the doctor's office or at the hospital about how much something's going to cost, oftentimes they can't get answers. And that's really troubling, I think, for just our healthcare system in general. And fortunately, something that digital health is starting to take on to try to improve. So the inputs are the patient's health coverage needs, as well as the provider costs. And the outputs are the ability to enable these patients to do price shopping, right? So why don't I compare how much a given procedure is going to cost downtown versus midtown, something like that. Hold on, I think someone's trying to join. Okay, Kevin, how long did I lose you for? Can you hear me? Kevin, can you hear me all right? Okay, I think your audio is not working, but hopefully it comes back. All right. Anyway, so Sidecar Health, what they do is help you do this sort of price shopping from a healthcare perspective. So if an insurance provider wants to enable patients to price shop, the patient then, they have their patients log on to this platform, select the coverage amount, and then their location. When their care is needed, they can see a map, like shown right here, that enables them to compare prices based on different practices or hospitals that they might go to. And the overall outcome is that the patient can lower their health costs and feel more empowered by having done this comparison shopping. Obviously, it's a little bit less feasible if you have an emergency type of situation, but for basic procedures, I mean, there have been analyses that have shown a difference of over, I think, 25 times in cost from going with one, like the cost of a Band-Aid. Literally, those Band-Aids that are given to you from hospitals are coded and they're reimbursed. And there are some hospitals that will charge an insane amount for Band-Aids, and then others that'll charge a normal amount. But then that same hospital that charged an insane amount for Band-Aids might charge a cheaper amount for getting stitches. So it's crazy. I don't I don't even want to dive into that rabbit hole of how ridiculous that is. But having apps like this might help push us to a little bit of a more sane system when it comes to the pricing of healthcare procedures. Any questions on that? Okay, so next is patient engagement, which is, I think, really important for some of these providers because they really do develop a long-term relationship with these patients. And really, having this engagement can help them ensure that the patients aren't getting sick in the first place or are seeing doctors when they should be seeing doctors or doing the right sort of reactive or preventative health decisions. So within here, you have things like health coaching, incentives to do things that'll keep you well, as well as access to different kinds of concierge care or care that can help you live a longer, more healthy life. There's also plan management, so how to help you choose the right plan. I think in the US, we are notoriously bad as patients at picking the plan that's most appropriate for us. So people are starting to develop tools that can help us do that. Because let's be honest, if you're just reading a bunch of words of what the deductible is and all that, it just doesn't mean that much. So having that presented in a much more easy to read manner, in a way that can enable you to say input what your desired needs are and what your health history is, and then give you the right suggestions, I think can bring a lot of benefit to us. And then telehealth. So this was on the provider side too, but there's a lot of payers showing interest in telehealth because it can really reduce costs. The cost of going to an ER or even a clinic in person are orders of magnitude more than just talking to a patient on your phone or computer. Okay, so I want to talk about Oscar Health. They're actually a full-blown payer themselves, but their mission is a little bit unique compared to some of the more established players, and it's that health insurance is very hard to understand, and by making it easier to understand, they can get better outcomes for their patients and better outcomes for their business. So the inputs are a patient's health info, as well as the patient's plan info, and then the network of providers that they have access to. And the outputs are analytics on that plan, as well as a communication with providers to help make sure that that patient is using the right providers most optimized for their condition and health data. So to set the scene, a patient wants a plan that is personalized to them, as opposed to one size fits all that may not be the best for their health. Next, a concierge team helps to identify the providers and care that are best for that specific patient. So it's sort of doing a lot of that work up front so that the patient being in the right plan can start to make the right decisions, see the right people, and have the right health outcomes that Oscar Health is looking for down the road. After that, the patient then uses the digital app to manage their own care team. So it becomes much easier to, say, get referrals or have the type of care that they want based on their health needs. And then the outcome that is most desired from Oscar Health is that the patients can choose the best care for themselves which then in turn leads to better outcomes. So here you can see things like they can track their own deductible, you know, how much they've spent out of their deductible for a given procedure, as well as understand their benefits. They can message their concierge team at any time they want. So it's a lot easier to get referrals. And then all of their claims, payments, prescriptions, lab results can all be found in the same place, right? I think as we start to have more of these digital apps, there's a concern that we don't want to use 18 different apps to manage our health. So what Oscar's trying to do is to put all of that sort of under one umbrella to help the patients make the right healthcare decisions. Okay, finally, data. So if you're an insurance provider of any sort, healthcare or otherwise, data is really your number one asset, right? So they use data to make risk adjustments, figure out which of their patients are the most risky and therefore need to be focused on to help make sure that their outcomes are optimized. Data platform. So how do we visualize a lot of this data to be able to make as a company the right sort of decisions, and then as well as to show it to the patients to help them get feedback on how they should react to their different health results. Also cost benefit analysis, that can be very important because, you know, you might say everyone should be screened for, let's say, coronavirus, right? We should screen everyone to make sure that we minimize people spreading it. That's probably true to an extent from a healthcare decision-making process, but from a cost, it might not make the most sense. Instead, what you might want to do is sample the most high-risk populations and then use that information to then sample more people within that area if you're seeing a higher incidence. So making these cost-benefit analysis of how much do we pay for on a diagnostic or preventative level versus how much do we just save money on the front end because it's not going to really do us much good on the back end anyway. And then population health. So that's looking at which of your population segments are most at risk, and then how can we take that information to improve outcomes within those population segments. You might hear groups like Kaiser, for instance, talking about the social, what is it, the social-based outcomes of health. So how your social economic status can really determine sometimes your outcomes that you see in a healthcare standpoint. And they're trying to address that by saying, well, what can we do to reach some of these populations in need to help them make better decisions around their health? And sometimes it even involves, you know, a lot of free services because they know that even though these populations can't afford them, by doing that, they're really going to save money down the road to prevent some of these chronic pain or chronic health issues like, say, diabetes. And then that sort of all goes along the lines of prevention as well. So here I want to talk about Comodo Health. So Comodo Health is looking at the fact that provider performance is very difficult to assess. So if you are an insurance company, you have a vested interest in making sure that the providers, the provider networks that you represent are doing a good job. And sometimes that's very difficult to do. So the input is all the health records within those providers, as well as the claims data. And their outputs are analytics on provider performance. So they can see, hey, you know what, this hospital gets a lot of diabetes patients and they're doing well. Or this hospital doesn't get a lot, but the ones that they do get are doing very poorly. So as a health plan, you can start to guide those patients with diabetes to the right hospital that's getting the good results, as opposed to the wrong hospital that's getting the wrong results. And then they can also create patient data maps that, again, help them focus on the right areas of need. So the storyboard is that a patient wants to know which providers are performing the best. After that, the payer then inputs their network into Comodo Health, and then the payer works with the providers to create better outcomes after they see who really are the problem providers, who are the providers that are doing the best, and therefore maybe they could benchmark a little bit and then share that data with the problem providers. The desired outcome is that the payer achieves better health outcomes at a lower cost, which is pretty much any payer's goal. Okay, so let's go to that Google form one more time. I'll give you 10 minutes to take a look and then add your payer digital health tool?
So I did GoodRx, which I'm sure you guys have seen the like 501 commercials that are on literally all the time. But it's a lot like one that you had presented with the different options of like different treatment plans and stuff for patients. So it's really similar in the sense that the provider would prescribe a certain medication, and I don't know if it's controlled by what insurance companies allow. That's the part I'm confused on. But basically the patient enters the medication and the dosage, and they can find different prices at different pharmacies so that they can, save money where they need to.
Very cool. Yeah, it's kind of like the one that I showed, except this is pharmacies. So it's which is also very interesting because there's so many different pharmacies that people typically have to choose from. And you can see in this example, even though these are probably, oh no, these are actually real numbers for Lipitor, which is one of the most commonly prescribed medications in the world. And you have a difference of, in this case, I mean, 5 or 6x between Ralph's and Walgreens, which are 2 blocks away. So pretty crazy, and probably a good thing to be able to see that as a patient. Anyone else?
I did one on a app called Lemonade, which is like the ID at the end. And basically it's telehealth, and for the storyboard, it goes along with payers and patients. But basically it's like a scenario where a patient has a non-emergent condition complaint that they want to see their provider for, but say their provider is booked for the next month or two. So the patient is often tempted to go to the ER where they know they're going to get seen, but most likely the payers have to pay more since it's the ER. So instead of going to the ER, they recommend downloading this app, which is basically called Lemonade. And you fill out the basic online questionnaire, and then a doctor reviews it. Oftentimes too, they'll do video chats with the patient. So you actually get to see a provider. And then at the end of it, they'll give you a prescription, which then you can fill out. So basically the desired outcome is that the patient gets to see a provider and get their prescription while also saving the payers more money, as opposed to going into the emergency room where they may have to pay more for the same prescription.
Yeah, very, very interesting. I know that's an area that there's been a lot of focus on in terms of healthcare costs, is how can we prevent people from unnecessarily going to the ER? I mean, even for things that you might think you need to go to the ER for instance, I cut my thumb a couple of years back and it was bleeding profusely. I ended up needing stitches, but I didn't really need to go to the ER to do that. You can get that taken care of at urgent care oftentimes. So I think having some of these services on there to help make sure that you go to the right level of care provider at the right time can end up saving the whole system a lot of money. Anyone else? Well, Safuni. I think you're on mute.
For me, I don't know, this like would be a good example, but I was focusing on Blue Cross Blue Shield.
Yeah.
Most of it I was focusing on like the current situation of coronavirus, and by looking at this, it has ability of covering a person who maybe go in different kind of places and wanted the coverage that doesn't limit to a specified positioning. And also it has ability to share its data with other health public departments to support the need of community itself. What I was looking for.
Yeah, I think particularly with these major insurance providers in an emergency situation like this, there's often a need to communicate a lot of different information with the patients in their network because sometimes confusion can end up not only leading to worse outcomes for those patients, but also more expenses if they don't have the right information of where to go or what's available to them. Okay, anyone else? I do want to, in light of this coronavirus pandemic, I want to go over a couple new apps that have been built very recently to address coronavirus. But first, I'll talk about a few data sources. So one of the reasons for this huge explosion in digital health is the explosion of data sources that are available for apps that people want to build for digital health. So genetic databases, and that includes not only the DNA of yourself, but also the DNA of, say, your tumor, if you're a cancer patient, your microbiome. Then there's also the meta-analyses on your DNA, you know, the RNA that ends up being transcribed from that, as well as the proteins around your body. Patient registries have really become a big thing over the last decade, where especially with rare diseases or just different disease advocacy groups, they'll try to get all of their members onto a registry where it's not a clinical trial, it's just a way for them to put all of their data into one source for researchers to use. And that's really created a boon in research because now they can just go to this one source and figure out who within a given patient population has certain outcomes. You know, it also kind of leads to what we were talking about with real world evidence. So when you have everyone in one database, you can suddenly analyze, okay, well, what's happening to patients in Virginia or patients who are within this hospital network, patients who are receiving this medication. So there's a lot you can do with that. There's also just the data from the clinical trials themselves. We're looking at analyzing that with digital health. There's biobanks, telemedicine, EHRs, credit card data. You'd be amazed is being used now in healthcare to try to figure out how purchase decisions are impacting healthcare outcomes. Claims data, public records. And then finally, this last category, now that we've got Google everywhere, there's a lot of information with our Google searches. And of course, there's a bit of a big brother aspect to that too, but when de-identified, that information can be very useful for hospital networks and for researchers trying to create better outcomes for people. There's also all the information that we get from our posts on social media, as well as our smartphones and any wearables that we might be using. So data is everywhere, but the industry doesn't quite know how to use that data. And that's why there's this explosion in digital health, because the industry is trying to figure out, well, how can we use digital solutions to make sense of this data and use it to improve patient outcomes? Any questions on that? This is kind of a heavy slide. There's a lot on there. Okay, so I want to go over, in light of coronavirus, 2 new apps that are being built for coronavirus. So one is Worldometer. So there's a lot of need among people right now to track the coronavirus outbreak. How many cases are there? How many deaths have been due to coronavirus? How does that break down over time and in different areas? So Worldometer was created in order to analyze that over time so that we can see, you know, how the cases have been rising. Another thing, because exponential growth is sometimes scary and difficult to make sense of, they are able to help you visualize in both linear and logarithmic. So logarithmic is basically just, instead of going 1 patient, 2 patient, 3 patient, 4 patient, each notch is an order of magnitude bigger. So if you have a straight line that's exponential growth, but you want to look for when it starts to level off, that's when you know you're starting to get a handle on the outbreak. So you can see with the US, even though this graph looks scary,
This graph, while still scary, shows that maybe we're starting with all this social distancing to make a dent in the growth of this virus. So here's a technology that was created to help people track the progression of coronavirus over time. Another one is Get Us PPE. So you might have heard about the shortage of PPE. I mean, most commonly mentioned is the N95 face masks that healthcare workers wear. So Get Us PPE is basically a way to enable people to help out if they have PPE that they want to donate. A lot of us might have that, but not know how we can help, who needs the help the most. So they've created this map of all the hospitals that need PPE as well as donation info. So if you want to help out, all you have to do is input your location, and then they'll show you what are the hospitals nearest to you that are asking for PPE, and then it gives you the information of how you can donate to them. So the desired outcome is basically that anyone who is able to help can help. And barrier of information is not going to stop people from helping. Any questions on that? Or anything you'd like to add of maybe cool things that you've seen being done with coronavirus? Go ahead, Sifuni.
I was asking, can we include WhatsApp as one among the new technology? Because like there's a WhatsApp Corona information app that you can join and get the information and track the numbers around the world.
Very interesting. I haven't heard about that. Tell me more.
Okay, so there's like, I think they created like a group. I don't know, a group or something. Yeah, like when you join, you get the information about the.
So would it be this coronavirus info hub?
Yeah. Yeah.
Yeah, it's very cool to see what different companies are doing to help get information out there on this coronavirus. You know, you see actually Facebook and Google are also doing things to help people see what's verified information about coronavirus, because obviously misinformation is a big problem. And then it looks like WhatsApp is doing some cool stuff as well. Sifuni, have you been using the WhatsApp coronavirus information hub?
Yeah.
What specifically have you found to be most useful?
Of course, most of the time I was looking at the cases that are being reported in my country. So you can ask and then they reply like what are the cases in which places. You can also fact check like what are the amount of people who are being suspected and what are treated, like, because there's kind of confusion in some of the data we're getting, because some of them is like estimated data and other one is the real data that has been measured. So
Yeah,
we need to do that.
absolutely. That's very cool, and not something that I'd seen. And I know WhatsApp particularly is used extensively outside of the US, including inside, but I know that outside it's one of the most popular apps out there. And so to see what they're doing with coronavirus is pretty interesting as well. So, you know, there's a lot of people who, obviously WhatsApp is a very sophisticated company, but there's a lot of people who are building very, I'd say, basic, not very sophisticated apps that are still very useful for coronavirus. I think in a case like this, where everything just happened all of a sudden, there's a lot of opportunity for people to create new technologies like this, Get Us PPE, that are just super basic, but can help solve a problem that exists. So, you know, with something as massive as coronavirus, there's a lot of opportunities for people to build useful apps to help out.
I have one more, like, I guess like website that I wanted to talk about for COVID. It's John Hopkins one where they have like the entire world map of confirmed cases. It gives you like a global confirmed case, as well as like it breaks it down to each country. And with it, it'll also give you like the total reported like deaths, as well as the number of individuals who have recovered. So it gives you like a little bit of everything. And then if you wanted to, like, let's say click on the US, like you could kind of see like the number of confirmed cases per state as well. And then it gives you like updates. Like we've been noticing that it updates like every hour now, and it's been pretty accurate.
Yeah, absolutely. I use this myself, and I find it very useful. So I just so that everyone's got access to it, I posted it in the chat because I think some of these resources really can be valuable for people who just want to keep tabs on what's going on. So I posted links to the coronavirus Johns Hopkins dashboard, as well as the coronavirus WhatsApp information.
Can I add one more?
Sure.
So actually one of my good friends created a nationwide like mutual aid platform. It's called covaid.co, and it allows people to just like search their zip code and request help from an individual to deliver groceries or medication, or like a lot of kids need academic support right now with all of their classes moving online who are in like K through 12. So it allows you to put like where you're most comfortable helping out, or what activities you're most comfortable helping out with. And then people can just go and request support from people who are offering things that they need.
Yeah, very interesting. So I see. So this
Right now it's really big in like Pennsylvania, Austin, Texas, and St. Louis, but they've been growing it. We have like 200 volunteers right now.
Wow.
27.
So give me a zip code.
Okay, this is she sent me her most popular zip code. It is 1 second. I wish you could type in cities. It says you can, but when I tried to do it, it didn't work. It's 19484. So like here, you can go and like if you click on someone, you can click request help from that person.
Oh, wow. That's very interesting.
So that's been another cool thing.
For sure. Anyone else want to talk about some new digital health solutions that they've seen regarding coronavirus? Okay, so this would be a good time for a break. I think that's all I've got. Oh, one thing I just want to mention is I've created this random idea generator. So one of your homeworks or assignments for this coming week is to come up with a storyboard that you created on your own. So you've been coming up with storyboards of existing platforms. I want you to start to create one for your own idea, whatever that might be. One way to help jumpstart this is I've created a random idea generator. It's a super basic platform that hopefully can also be inspiration for what can be created. It took me probably 2 hours to make, and it just randomly gives you different ideas. So it's got on one column a bunch of ideas like Uber, augmented reality, VR, Google, things like that. And then the other is healthcare. So it might be like Uber for cancer or Google for elderly care, something like that. So that can help give you ideas, because with digital health, it really is it's still so much in its infancy that if you just pair a popular idea that worked in just regular tech with a concept in digital or in healthcare, then you probably have a good idea that could potentially be a real business. So it's just something I want you to start thinking about, and then it'll be an assignment for this week. So if you want to, during the break, I'll post the link to the random idea generator, and then you can check it out. If you want to as well, you could use the break to come up with some of the coronavirus resources that you've been using, and then get some more participation points. So let's get back here at 4:30. And then in the last hour, we'll talk a little bit about the basics of web design. Any questions before we go on break? All right, see you later. Okay, so I just wanted to share with you briefly, before I get started again on the lecture, that idea generator. So this is kind of a silly example, but Farmville, I don't know if you're all familiar with the mobile game Farmville, but Farmville for rare disease, right? So you might imagine something where instead of growing a farm, you're trying to grow like a therapy, and you're going through the different clinical trials and all that for a rare disease, and it might teach people how that process works. Reddit for electronic health records. So this might be people using sort of a discussion forum to talk about the problems that they're having with electronic health records. Because right now in hospitals, there's a lot of difficulty with the usage of the health records. And in fact, if you ask most doctors, they'll say usage of the health records is the worst part of their job. Maybe if they had some sort of like Reddit to vent and complain and troubleshoot for each other, that would help alleviate some of the issues. Wikipedia for nurses, right? So a lot of nurses have their own particular terms or issues that they deal with, and to maybe have a living encyclopedia for them to go to could be helpful as they do their jobs. Decision support for diabetes, that one's a lot more straightforward. So how do you as a clinician understand, based on the type of patient that you're seeing, their demographic or disease attributes, how to go about treating them? So these are completely random, and I was just making up those ideas as I went along, but it kind of goes to speak for the fact that there's so much that could be done in digital health that you really don't need to have some genius idea. I think just thinking outside the box a little bit, you can come up with something pretty cool. So the idea behind this assignment is just that you would create, say, in this case, big data for clinics. So how can you use data to help clinics run their business? Come up with that idea, do that storyboard like you've already done several times for real ideas. And then that could be what you end up doing for your mock-up on your midterm. So just want to get you all started on that project because that's one of the major projects for the class. Any questions about that before we move on with the lecture? Okay. Okay, so I want to talk a little bit through the stages of web design. So a lot of people talk about web design as a pyramid. And on the base of the pyramid are really the most, they call it low fidelity, right? So like lo-fi aspects of your idea. And on the highest part of the pyramid, you have the hi-fi. So what is the highest fidelity, but then also the most expensive to make version of your product. So on the low end, we have the sketch, and we'll talk through that, but that's basically what can you draw on the back of a napkin to basically show proof of concept for what is your idea. The next level up is a wireframe, which shows the basic function and blueprint of what your mock-up looks like, but it doesn't really include any of the making it pretty, right? And there's a real purpose to that. It's not just because making it pretty is hard, so we want to do that as another level of fidelity, but because when you leave design out of it, you can really get to the basics of, is this going to be a usable platform? So a lot of people actually, and we'll go through this in this lecture, there's tools for making web frames that are purposefully bland, right? They basically look like something you would draw with just one color marker, one black marker. And they do that because they really want you to focus on the functional part. Finally, a mock-up is where you start to get the design involved. And then a prototype is where you have something that not only looks nice, but also works, or at least works to an extent. You know, you might just be sending like an email to someone behind the curtain, but you're able to click a button and it actually does something. It takes an input, turns it into an output that is useful for the customer. So those are the basic stages of web design. For the midterm, we're going to take it to number 2, which is basically just a wireframe of your idea. And then we're going to take a subset of those wireframes and then develop them into full prototypes. Okay, so the sketch is basically just how to communicate the idea as if you were trying to explain it to a friend or an investor at a dinner meeting and you were writing it on the back of a napkin. So you're basically just trying to explain the crux of the idea in a visual manner, but also in a very simple manner. So this was an actual, I mean, this is not the napkin, but this was what Jeff Bezos drew when he was trying to explain Amazon to some investors. So his very first money that he got, there was no product or prototype. It was just kind of explaining how selling books online could lead to a better customer experience and therefore growth. So this is an example, like I was telling you, with the wireframe. It's not really all of that. It's not well designed or anything. It's just a basic of, okay, well, if a user is going to search for something that they want, how does that look, right? And then what would the results look like on the other end after they search for that item that they're looking for? And, you know, how does the keyboard get involved? How does this look if it were to be on mobile versus be on desktop? It's really all about how the content will be structured and put onto the screen. So again, they try to stay away from design because that can just kind of muddy the waters, right? If you go to with design, people might not like the design and therefore not like the idea. If you stick with a wireframe, you can really just get to the basics of what this idea is and what it's supposed to do. Okay, and then finally, a mock-up. That's where you really start to get to design. So that's the high fidelity visual representation of the product. Here's an example of not Amazon, but kind of like an Amazon look-alike. And they've figured out what their color scheme is going to be. They've figured out, you know, how big they want their pictures to be, all of that. So that's where, and usually whoever creates the wireframe is a different skill set from the person who ends up creating the mock-up, right? So we might not have the luxury of having someone who's good at design and someone who's good at just the functional coding on one team. But ideally, and in any developed company, those functions are separated because usually the person who's good at design is not the same person who's good at just the basic back-end coding. Okay, and then finally, a prototype is something that can be tested by users. So here you have like the full-on Amazon app. It has working buttons, data manipulation. You can take it through a user testing and then use the results from that user testing to figure out, are people gonna actually use this product? Do they like this new feature that you're gonna implement? And the idea is that it's a finished product proposal. So it's not necessarily the product itself, but it's your proposal of what you think the product should be. And then you put that out to the users and then they'll tell you whether or not you should actually implement it. Any questions about the stages of web design and how that sort of goes up from a sketch all the way to a prototype? Cool, it's pretty straightforward. So again, you're going from lo-fi to hi-fi. So at the basic sketch level, it's really just pure function. How is this going to work in a conceptual way? And then the wireframe, it's sort of taking that into, well, what does this actually look like on the screen? And then you start to layer design and function on top of that. And any of these stages can be used to get your business off the ground. Kind of depends on, you know, where your strengths are and, you know, how much someone might be willing to fund your idea based on what you've done in the past, something like that. If you don't have as much credibility, you might have to take it all the way to this prototype stage. But again, like Dropbox, that was just a video. And then it went from there. Okay, now one thing that is very often quoted in web design is that premature optimization is the root of all evil. So I have this comic, which I think kind of illustrates that, where this one person is asking, hey, can you pass the salt? They wait, nothing comes. I said. Then their friend says, I know, I'm developing a system to pass you arbitrary condiments. It's been 20 minutes, but it'll save you time in the long run. So there's always someone on the team who wants to automate as much as possible. You know, let's say when we're thinking about an MVP to deliver groceries, right? They want to say, okay, well, a user should be able to pick from all the different items in a given store, and that's updated in real time. Wouldn't that be great? If we did anything less, it really wouldn't be the right customer experience. But then the customer ends up waiting, and by the time you implement, either someone else has developed something that they like, or maybe they didn't want what you thought they would want all along. So the idea is just pass them the salt, and then you can start to work on maybe that iPad that they can then click salt, ketchup, whatever, and then a robot delivers it to the table. So all that is premature optimization because we don't even know if that's what the customer wants. The idea is just give them what they want in as simple of a way as possible. We can optimize as we start growing. So again, don't over design at the low fidelity, low fi steps. So if you're still at that early stage, just give the customer what they want. Okay, so this is another commonly used graphic on what a minimum viable product is. So the wrong way, if you're trying to give someone a car, is to just give them a really well done wheel. And then, or maybe at the next step, give them a really well done like body, and then half a car or something like that. The customer is not going to like any of those. You have to provide a function. What can you do with just one wheel? Not much. So instead of doing that, it's better to just start with a skateboard, because the reason why the customer, or the reason why you think the customer wants your product is because they want to get from point A to point B. A skateboard will get them there. It might not be a car, it might not be what they really want, but at least it provides the function that they want. Then from a skateboard, you can upgrade to a scooter, bike, motorbike, and then finally a car. So any questions about that or about how that works? So, you know, another example might be if you're trying to build like the next great social network, spending all the time building better filters than Snapchat, but then having nothing else isn't really going to get you anywhere. Instead, what you want to do is figure out what are the needs that people have in a social network that are not currently being met, and just meet those needs in as basic, simple, fundamental way as possible. And then build those filters or whatever else you want to do. All right. So these are just some tools that can be helpful for creating mockups. One tool that I want to go over, because we're going to use this for our midterm creation of mockups, is called Balsamic. And I think the best way to describe Balsamic is it's basically PowerPoint for wireframes. So it's got all of these little built-in stickers that you can put onto your mockup. So rather than having to draw your own navigation bar or draw your own buttons, it just has those, and then you can put those in. They look really basic. It's only black and white. There are no pictures or anything, but it helps you build that mockup. So your final product should look something like this, right? Where you're basically showing the content of, okay, well, this is the name of my app. This is what it's going to look like. I want to put my nav bar, you know, maybe right under the header. And then we're going to feature all the work of the people who have submitted their, in this case, art portfolios here. And then maybe there'll be a section for meeting each artist, so on and so forth. So it's all about how do we know that we want for our mockups to have a certain array of content, right? Let's go back to Wikipedia for nurses, completely random thing from that generator, right? We know that we want to say have difficult to understand terms defined somewhere. Where are we going to put that? Are we going to put that at the top, at the bottom, somewhere in the middle? Are we going to have to make them click? a certain link for different categories. Maybe the nav bar will say like, oh, oncology nurses versus OBGYN nurses versus emergency room nurses. And then maybe they navigate to their own personalized information from there. So the wireframe is just kind of structurally, where do we want to put all of the content that we plan on including in our app so that it can be usable by the customers? Any questions about what that looks like? This is an important one because it's going to end up being your midterm, which I think is a quarter of your grade. So this would be a good thing to ask questions for. Maybe not now, but in the discussion forum or through the chat window. Okay. So one thing I do want to cover, this is kind of a semi-assignment. You don't really have to do a lot of work on this this week, but just send me an email address that you have that's associated with a Google Drive. Raise your hand if you have used Google Drive. Okay, so I think everyone, raise your hand if you haven't. Okay, good. So since I'm assuming from this, you can private message me if you're if you don't use it, but I'm assuming that you all use Google Drive. So all you have to do is send me that email. I will put you onto our product license for Balsamic. And then once you do that, you'll be able to install Balsamic onto your Google Drive. So instead of creating like a Google Doc or a Google Sheet, you can actually create a Balsamic wireframe on Google. And then that's where your mockup is going to live. Okay. And again, it's just going to be a wireframe mockup. So don't worry about the design at this stage. It's really more about the formatting and the content that you want to put out there. The second half of the class, we'll start to put design into there and turn that into an actual functional prototype. Okay. A little bit more about the structure of this. This wireframe that you're going to create for your own idea will be an individual project. And then that'll be due, I think, in 3 weeks, basically midway through the course, maybe 2 weeks. And then the second half, we're going to pick the ones that get the highest review during our presentations of these to be turned into prototypes later on. And that will be a team project. I aim to have teams of about 3. Okay. Questions on that? All right. So there's this whole concept of visual hierarchy when we talk about design and computer design. So with visual hierarchy, there's a few things that are most important with how we design a given web page. The first is layouts. There's different patterns that we can use that really reflect how a given user, when they look at a website, end up scanning that website. There's been a lot of science done on how they scan those websites that has led to the creation of F pattern and Z pattern layouts. We'll talk about that a little bit later. Color. Color is very important. And a lot of people who haven't had basic training and color theory, they end up creating very harsh websites that hurt the eyes or maybe create weird optical illusions that make the website less usable. So we'll talk a little bit about that. There's also within colors contrast. So how do we take advantage of contrast between light, dark, warm, cold to create a beautiful web design? Finally, typography is important. So what do our fonts look like? Font size, font style, and then spacing. So we don't want to overload the user with content because especially nowadays, people just don't read that much. I mean, if you want to get them to read 3 sentences in a row on your website, good luck. So you got to figure out much more simple ways to give them that content. Okay, so layouts, there's F patterns and Z patterns. So F patterns are really useful for if you have a lot of content. Picture if you've got like a Wikipedia type of page where you're just trying to deliver information to someone. So that would be our Wikipedia for nurses. It would probably need to be in an F pattern type of format. And I'll show you on the next slide what that looks like. And it's also when you need to control the user journey. So if you want to guide what they're reading when F pattern is most relevant. Z pattern is if you're a little bit more minimalist, and what you really want is the user to do something right away. So not just like sit down on your site and read for 5 minutes, but instead there's a call to action of what they can do, whether that's figure out a place to donate PPE or input your information for your healthcare system, something like that. It's also useful for guiding someone through features. So F pattern, the basics behind this is that there's been a lot of evidence that people will scan the top line all the way from left to right, but then as they get further down the site, they start to scan a little bit less. And so a lot of websites are designed that way to take advantage of that fact. So you'll actually see a lot of websites where that header might have information or input spaces all the way across the top, but then really start to limit themselves in what they put as you get further down. Wikipedia also looks like that. You know, you'll notice that there's like this table of contents on the right side instead of more information. Z pattern, an example is like Facebook, where what they really want you to do is sign up. First, you know, learn just enough to know that you want Facebook and then sign up for it. So here it's just kind of, you go left to right on the top, but then just scan all the way down for sort of these icons, and then you might move over to the sign up button. So here they're kind of guiding you towards signing up. Does that make sense? All right, feel free to interrupt at any time with any questions you might have. So color theory, this is an example of a color wheel. And you can see that these colors are all placed in a specific order. Now, and so these wheels are actually very useful to a lot of web designers. They'll use these to figure out what sort of color schemes they want to use for their website. So there's this whole theory of what's a warm color versus a cool color. So your warm colors are sort of your yellows, reds, purples, and then your cool colors are your greens and blues. It's also sort of related to, on a rainbow, you know, what's the low frequency, which is sort of like red, infrared, versus what's the high frequency, which is the blue. So for whatever reason, in our brains, we turn those colors into what's a warm versus what's a cool color. And there's actually a lot of evidence that you can direct the user's attention with the use of warm colors. So if you want them to click on a button sometimes, or if you want them to notice something, sometimes using these colors will really help. Now, high contrast text will also draw the user's eye. So that's just another thing to keep in mind, is it's not just about what colors you're using, but how dark versus light they are. So here, if I'm going to use light font, it helps to have a dark background. Here, if I have a light font on a light background, it's harder for people to read. So it's better to use this dark black on a white background or a white on a dark black background. But of course, there's exceptions to any rule. Okay, so color theory. Again, these are all ordered in a certain way, and this is on purpose. So the idea is to use what's called a triad color wheel. And this color wheel, by the way, there's a bunch of different kinds. This is an RGB, so red, green, blue. And the basic idea is that any combination thereof can create any other color. And so the red, green, blue are opposites from each other, or they're really sort of triad opposites. So if you put this triangle in the middle of the color wheel, it can tell you 3 colors that complement each other really well. And so a lot of web designers will use this when creating their color schemes. And I don't know if you've noticed on PowerPoint too, but there's a color theme feature on PowerPoint. It's not used quite as much, but you can pick among these triad color schemes to help design your PowerPoint slides. So there's this concept of 10 commandments of color theory. And I'll just go through these really quickly. But number 1 is know the color wheel really well. So do you know what each color signifies? There's also a lot of theory behind what red versus yellow versus green should be for in terms of site function. So in this case, they're saying red is like love, energy, also intensity. So this might be like a coronavirus solution. If you're trying to alert people on something, you might put more reds into that website. Yellow is sort of like trying to grab their attention, but it also could be joy as well as intellect. So yellow might be useful for something that's more to inform, or also you see it in a lot of like lifestyle type of website brands that are supposed to get people really involved in, say, cooking or crafts or something like that. You'll see a lot of blogs actually are yellow. Green is like freshness, safety, growth. So you see that a lot with finance type of companies. You might also use this if you're looking to create like a security app for a different firm. And again, these aren't hard rules, but they're just sort of basics to go by. And you'll notice that a lot of companies that you know right now use these color principles in their design. Blue might be stability, trust, serenity. So you see blue with a lot of large banks, for instance, where they're just sort of trying to produce an air of reliability or stability. And then purple is like femininity, but also wealth or equality. So again, they're not hard, fast rules, but this is something that a lot of web designers will use when they're choosing their color. So it is pretty important though, when you're starting to work on your web idea, to figure out, okay, well, what color palette do I want to use? Because you want to be consistent with it. And so it's, maybe not the most like black and white, there's hard rules on which colors you need to pick, but just know that whatever you choose, you're stuck with for a while, because it's often very difficult to change your colors once you start to build a brand and an audience. There's also just picking the right color combinations. So I won't go through all these in depth, but basically there's a lot of different ways to think about what you want to use as your color combination. Sometimes it's best to just go with the same color throughout, but just different contrasts of that color. Sometimes you want to go no color at all. But there's a lot of different theories of how you can use color. And really the only take home here is just know that these theories are out there and that you can Google them, look into them more in depth. But there's no really hard and fast rule, except that you don't want to do the wrong kind of contrast. So don't do something like these websites, right? These are hard to read either because they're very jarringly different colors, or maybe there's too much going on. Using textured backgrounds or weird fonts is often not recommended because people just won't take your website seriously, and it'll just be so rough on their eyes that they won't come back. Okay, so buttons. Buttons are going to be very useful for your prototypes because you want to create function. And so buttons are usually the #1 way that you produced some sort of function. So we'll get to this when we talk about JavaScript, but basically a website is typically static until you click a button, and then that'll trigger the JavaScript to do something, right? Whatever that might be. It might be playing a video, showing an animation, or it might be transforming the data that a user has inputted into analysis or some sort of output that is useful to them, right? With the COVID website that Elle shared, you put in your zip code, you click a button, and then that's the trigger for the website to start to show the list of people who are wanting to help near you. So just some basics on buttons. You can create depth with things like lights and shadows. Don't worry, you don't have to draw these shadows in with web design. There's typically built-in packages within web design where you can basically say something like shadow equals yes, or shadow equals this big, and then it will automatically do this for you. So there's a lot of convenient things put in to help you create buttons that look like buttons. You're not just drawing it all from scratch. You also want to direct your attention with colors. So here's an example of sort of the wrong way to draw a contrast versus the right way. So The wrong way is just to have equally bold colors for the buttons that you're trying to show. It's much better to show the button that you want them to click as the bold one, and then the button that you don't want them to click as sort of the either faded out one or the less bold one. So that's just kind of a basic principle about how to draw a user's attention through the design of your buttons. Okay, typography. So a couple do's and don'ts. Well, actually, really just one do and don't with regard to typography, which is do always use clear, readable fonts. Fonts are really not a good place to get creative. You know, save like the whimsy fonts for your wedding invites. I mean, it works in like wedding web pages that people set up, but it doesn't really work in anything that you want people to take seriously. So you might have some nice font as your header or your brand, your logo, but when it comes to the actual content part of your site, just keep it simple. All right, here's a couple guidelines on font size. I won't get too much into this, but basically know that there are guidelines. And then you can refer back to this as you're starting to design your web page. But basically, you want your font to be no less than 12-point font. And then there's this concept of H1, H2 headers. You went over that in your Codecademy training. Anyone want to talk about the difference between an H1 versus H2 header? Yeah, Kevin. You're on mute.
Isn't it, don't they sort it by size?
Yeah, basically. So H1 would be which one, the bigger or smaller?
Bigger.
Yeah. And so it's kind of like a hierarchy, right? It's like if you're making notes, this might be my H1, these might be my H2s, right? Actually, in this case, these are probably more like my Ps, right? If you remember from your training, but it's kind of just a hierarchy of headers. Line spacing should be just a little bit bigger than the body. So a little bit bigger than like one or a single line spacing. You just want to leave enough white space between each line that it's not intimidating for the users. And then you want to make sure that you leave a lot of white space between headers. White space is really, I think, as you'll see with a lot of different successful websites, if you do some benchmarking, they try to make use of white space so as not to intimidate the users. And by white space, I'm not necessarily saying the color white, although that it typically is the color used, just because it's the cleanest, but just blank space, right? So if your website is like a bright green, just having a lot of that non-content, non-text space so you don't overwhelm the user. Okay, a little bit on nav bars. So nav bars are very important, and I think all of your prototypes and wireframes are going to need nav bars because that's how users navigate a site. Now, there are sites that have, sort of avant-garde sites that have tried to get rid of the nav bars, see what they can do without using nav bars. But I would say that for what you're doing, because you're really just trying to create new ideas within a new industry, as opposed to making your lack of nav bar your big differentiator, I'd say just kind of keep it simple, stick with the most commonly used nav bars. So there's really two major nav bars. There's the ones that you have on the top of your site, right? So it might be like, and by the way, nav bar is sort of their tabs like home, about us, maybe a navigation to different specialties. Like let's say going back to Wikipedia of nurses, maybe in oncology, OBGYN, emergency room, etc. So it's a way for them to easily navigate the site. The top ones versus the side. The top ones are a little bit more space efficient. So you can just have them as one bar on the top of someone's screen, while the rest of the screen can be devoted to actual content. They offer a little bit better visibility too, because you can always have them out there and everybody always looks to the top, as we mentioned, and sort of that F frame versus Z frame. The one thing that you always know a user is going to look at is that top bar all the way from left to right. So having a nav bar on the top is good for that. It also helps you prioritize because again, it's left to right. So you can say that, you know, whatever you really want them to click, you can put on the right or the left. And then whatever you feel is less of a priority, you can have more towards the right. However, it's also more difficult for them to scan. So on a side nav bar, like right here, you can actually have them look at all of them pretty much at once. You can fit a lot of topics there. However, they take up a lot of space. So typically, if you can think of sites that you've used with a side nav bar, they'll slide in from the left to the right of the screen. And then there's also more equality. So because you can fit a bunch of them on here, they're really looked at by the user as equal. So if you've just got a bunch of different categories, like for instance, going back to the Wikipedia for nurses, just the different specialties where no specialty is, you know, a higher priority than the others. We want to treat the cancer specialty the same as OBGYN, the same as emergency. That vertical sidebar can actually be more useful. Another thing I would say too is sometimes you can collapse one topic into subtopics. So you might have a top nav bar, and then let's say item 3 is specialty. When they click that, one of these vertical nav bars then drops down, and then that might show the different specialties. Okay, any questions about nav bars? Okay, layout. Layout is also very important and also surprisingly standardized in web design. So a lot of web pages, in fact, almost all of them, use what's called Bootstrap 12-column format. So Bootstrap doesn't really mean anything. It's just basically a framework that's been created for web design, and it just happened to be named Bootstrap. But it's 12 columns. So you'll notice here, a lot of web pages are divided like this. So you'll divide, if you want a web page that's divided in 2, you would use the 6, right? So I would say that I want this to be category 6, and then each block that you implement will be laid out half and half, right? So 6 plus 6 equals 12. Once you've equaled 12, you got to go to a new line. So something that's designated as a Bootstrap 6, you'll only be able to fit 2 of those blocks of content onto a given web page. As those numbers get lower, then you can start to fit more of those columns into a web page. So no one really uses 1. You might use it like a 1 next to an 11. So if you want that 1 just be like your side nav bar or something like that, you would give that a value of 1, and then whatever you want next to it might be an 11, and that takes up almost the entirety of the screen. Another thing that's not on here is 12, which is basically just, I want each element that I input to take up the entire column. So then each additional element does not get to go next to it, it just goes below it. So it's kind of an abstract concept, but I believe that was in your Codecademy training, right? Have you gotten to that yet? The column format? Okay, not yet. So you'll get to that. This is basically the prep for that. There's also the concept of responsive design. So this is where these Bootstrap columns can really come in handy the most. You'll notice that in a lot of websites, when you're looking on your big screen or your desktop computer, there might be several columns of text on that one given page. Let's say like your favorite news site. But then when you put that onto your phone, there's just that one column. And so that's basically if they have something that maybe there's 2 columns on the big screen, then that would be what they designate as a 6. And then to go to the 1 column, they designate it as a 12. So again, it's a little bit abstract here, but it'll make sense once you start to go through that Bootstrap training on the Codecademy. That'll explain in a little bit more detail what these actually look like in practice. But the basics of responsive design that you really need to know is that you need to know that how something looks on a big screen cannot be the same as how it looks on a phone. So you need to start thinking about what you're designing your prototype for or your wireframe for. Am I designing it to be a mobile app, or am I designing it to be something that's going to be viewed on a large screen, let's say in an operating room? Because that really determines how you design that product, and also whether you want to go mobile first or whether you want to go desktop first. So that's a big thing that a lot of major companies have to deal with, is mobile first versus desktop first. In fact, Facebook had to make a transition at some point where they started as a pure desktop software or website. And then they realized about 5 or 6 years into their company's life that everything was going to be mobile. And now people almost entirely use Facebook on mobile. So at some point, they had to tell all of their designers, all of their engineers, when you submit a design, I need that design to be strictly for mobile. And then you can think about how that stretches out into a bigger screen later. But it was really a paradigm shift within their engineers of whether they were going to develop something that's going to be useful in the palm of their hands versus something that would be viewed from their computer. So that's really something that you want to think about when you start designing your app is this a mobile app or is this a desktop app? Any questions on that? Okay, so again, if you have something designated as a Bootstrap 12, it just kind of stacks on itself. If it's a 4, then again, 4 plus 4 plus 4, you take 3 of those elements to equal 12. So it's 3 column stacking before they go to a new line. So on and so forth. With a 3, that's 4, because 3 times 4 equals 12. And then after those 4 are put into 4 columns, then they go on to a new line. Okay? Okay, so another big concept in web design, not really a concept, but just a practice, is copy benchmarks as much as possible. Don't try to reinvent the wheel. If you want to create Wikipedia for nurses, probably be a good idea to just benchmark Wikipedia and make a design that's similar to them, because that's what people are going to be familiar with. So you can search on CodePen or Code Sandbox. So I built that app that I showed you, the idea generator, on Code Sandbox. I also built it once on CodePen as well. So these are really cool sites where people can just build very basic web pages and then share it with the community. And then as they share it, the code behind those web pages is all there. So you can basically copy their code and then use that as your own. You can also do this thing from your browser called inspect an element, which here I did this with CodePen, where I right click anywhere on the site and then something comes up that says inspect. When I do that, the code for that site actually shows up. Now this is Chrome. Different browsers might function a little bit differently, but you can always just Google how to inspect an element with blank, whatever your browser is, whether it's Firefox, Safari, Internet Explorer, they all have these tools. And so it's really, for me, been kind of empowering since I learned to do this, because I can look at how any website out there has been coded. And it's available for everyone, because in order for that website to display themselves to the user, their code needs to be up there front and center. You can't steal their secrets. You can't steal like their algorithms that are in the back end, because that just doesn't show up. But everything that's front end can show up on your screen if you inspect it from the browser. So there's a lot of ability there to benchmark what's already out there. Okay, so that's a little bit of the intro. Our assignment for the coming week is going to be to do 2 more lessons on Code Academy, and I think that will wrap it up for HTML. So during those lessons, you should go a little bit more through how the Bootstrap columns work and all of that. There's also the usability testing reading, which I realized on Sakai was assigned for today, but actually it's not due until next week. So that's one less assignment, if you already did it, that you have to do for the following week. And then Storyboard for your digital health MVP. So that's basically what you've been doing for real ideas. I just want you to use the idea generator that's posted in the chat to come up with your own idea. Again, you don't have to use the idea generator, but it's just a nice way to jumpstart, get the creative juices flowing. You can come up with whatever idea you want. Some of you have already told me ideas during the participation in these first 2 lectures that I think would be great to pursue as a wireframe mockup. And then also, this isn't really like an assignment that you have to do, but eventually for the completion of your wireframe mockup, you're gonna need this Balsamic extension. So just go through the process in these slides. I've shared them with you to get that extension. And then that way you can get started on the wireframing.